Hi, I'm Dr. Hakim, consultant orthodontist, diplomate in the American Board of Orthodontics, and I practice here in Dubai. And I'd like to welcome you to our very first podcast. It's nice to meet you. So welcome. This podcast is all about you, your oral health, and everything in between. So today I'm joined by Dr. Anna and Dr. Omar, my colleagues, and together we're going to be exploring all sorts of issues related to our subject matter. Today, since it's our very first episode, it's nice to meet you, and we'd like you to meet us. So to get this on the road, I'd like to ask Dr. Anna our very first question, and that is, how are you in Dubai? What brought you to Dubai?
All right. Hi, everyone. I'm very happy. First, I'm very happy to be here. And again, I'm Dr. Anna. I'm a specialist orthodontist, and I've been working here in Dubai for around 4 years. And my journey basically started, I did pretty much all my education in Brazil. So as soon as I graduated, I knew that I wanted to be in orthodontics. And I started the master's right away. And I did the 3 years. I did a little bit extra because of COVID. And after that, I decided that I wanted to live abroad. So that brought me to Dubai, and here I am.
All right, very good. And then also with us is Dr. Omar. Tell us about your orthodontic experiences and practicing in different countries.
Well, as you mentioned, yes, I was privileged to practice in more than one country. I was actually grew up in Dubai. This is where I did my high school education. After that, I ended up going to Australia. That's where I did my general dental training, got my internship all done. Great place to work by the beach. I was on the Gold Coast, so it was between in the clinic, lunch break, run to the beach. After that, decided to come back here. That's where the family are in. Worked in Dubai 4 years, then it's decided it's time to do orthodontics. So flew to England, in Manchester, rainy Manchester. So now it's the gloomy weather experience. Had the privilege to work with the NHS at the University of Manchester, dental hospital. Spent 3 to 4 years there. Got my degree, managed to see the membership of orthodontic with the Royal College of Surgeons of England. And once all that was done, decided enough with the rain, let's come to Dubai. More fast-paced working here, as the city of Dubai is, always running, always functioning. And I think this is what we provide here in Dubai, just constant, on-the-ball, high-end treatment.
Yeah, I'm sure you couldn't get back here quick enough, having spent all that time in sunny Manchester. So again, I think it's great that we're having this. This is an introductory. This is our first episode. So, do you have any questions for me, guys?
Yeah, I think we want to know. Everyone actually wants to know also, like, about your experience, like your journey.
Your journey, Dr.
We like
Hakim.
to know.
Well, I mean, it's my journey started a long time ago. It was. I graduated from my orthodontic residency program at the University of Colorado. My wife is an architect, and my parents were here at the time. So she came out to visit, and we took a detour. Instead of moving to Chicago, we moved to Dubai, and we've been here ever since. So I think this is a very common story, and it's probably similar to at least you, Anna, because Omar, I think you were born here,
I'm
right?
born here. This is home, so privileged to be here. Enjoyed my time here. It's great. You get to meet people from different places. As you see, people are always coming and going.
Exactly.
And I guess this is what happens when you stop by in Dubai. You don't want to leave.
Yes.
That's true. That's true. 20 years on with 2 more additional kids in Dubai. Certainly.
Yeah.
Good. So then tell us, Dr. Hamid, then why orthodontics for you?
Well, for me, as a dental student, I've always been fascinated by growth and development. And it was either to become a surgeon, where I would be repairing or doing a lot of fixations of defective craniofacial structures, or going into orthodontics, where I actually studied genetics to further understand how this, the face develops and hereditary and so on and so forth. So He was either going to spend 7 years to do a maxillofacial surgery residency, or go and spend 3 years and combine that with the research degree in genetics, which I did, and I've not looked back since. So that's my choice for orthodontics. I also like the fact that we have such a big impact on our patients. We deal with a lot of adolescents and younger patients who come in, and I think, every time, it never gets old when you finish that treatment and the patient and sees their smile for the very first time with the appliances off. This, it's just a very rewarding experience, and I'm glad to be able to do it and to provide such service.
That's amazing.
Yeah,
I think that's for all of us. Things when you see that end result after 1, 2, or maybe 3 years of hard work to get there, to see that life-changing moment for people.
And that's a specialty that we stay a long time with the patients. It's a treatment that may last a long time, so it's very nice to connect with patients, with their family, parents, and everything. We create this environment that it's really nice. So by the end, we're super happy, and of course, the patients are more than happy with all of that.
Yeah. No, well, Dr. Omar, is there any patient in particular that kind of that stands to mind about? That you just would like to share with us, the patient experience?
Yeah, I would say, if anything, it's like you said, how we see patient growth. I've had a patient actually walked in, or even his mom walked into the clinic with the patient, 8 years young, and she was like, look, I think it's not time maybe for orthodontics. He's still too young, but my kid is telling me I want to get my teeth straight because I'm getting bullied. And that's someone who's as young as 8 years old, in school, actually being harassed, being bullied, doesn't enjoy sitting at lunch with everybody because of how his teeth were. And looking at the kid, he actually had severe anterior crowding. None of his front teeth were straight. They all overlapped each other. And he suffered. He didn't want to smile. He's like, please, I just want them straight. And the mom was like, that's literally word by word what my son told me. So can we do anything? And yes, we had a nice, quick, short course, 6 months, got those nice front teeth in a place where, one, it's safe to avoid any problems or trauma to the front teeth because of how jumbled they were. And the kid was smiling. And you see every month by month at the beginning of treatment, he was so excited to start. He wanted to get the treatment done. And as we came towards the end, when things start lining up, the first question is, when can I take the braces off? Now he's just walking around smiling. He's like, I'm ready. I just want them off. And yeah, we took them off. Now we just review him every 3 to 6 months. We check he's okay, he's still growing. Maybe still needs stuff in the future. But the nice thing is, even teachers told to the mom back, she's like, oh, your kid's now different. He is not shy around his other classmates, happy when he goes in lunch break, plays with everyone, and everyone notices that he's smiling more.
Well, that's phenomenal, and I think we can never really underestimate the impact that we have and how much it means for some of our patients to get this treatment. And that's why we are actually doing this podcast, because we think that there's a lot of misinformation out there, and we'd like to share our experiences. Yes, I may not sound it, but I am American trained. I did my first dental degree in Libya, which is in Africa, but then my orthodontics and genetics degrees are from the US. Dr. Omar studied in Australia and in the UK, and Dr. Anna's in Brazil. So we kind of represent around, 6 continents?
Yeah, you can say.
5?
It's a good mixture, right?
Yeah, six.
Yeah, we've got them all, yeah.
Yeah, so pretty much we have them all, and we're all practicing in Asia. So kind of every
everything.
continent
So
is
we've crossed them all.
So I think this is very important that we bring our different perspectives.
Yes.
Some things are common, some things are different, but this is why we want to do this, and we hope you can join us for all the future episodes.
And I think that is the good thing about Dubai. Once I came here, I realized how many cultures, how many different points of view and training. So we combine that together the way we do. We learn. We maybe the other person will also absorb something from that. So I think that makes sure it's very helpful for us as professionals. We learn a lot, and we can provide the best treatment plan, the best option for the patient.
Yeah, I think it's very important to stress that no two patients are identical.
Absolutely.
And even if tooth-wise or clinically things look similar, every treatment plan has to be customized based on the patient. So that's fantastic. I think there's probably one question that you are probably thinking is, how did we all come together? And essentially,
it's a small world.
Well, yeah, it's a very small world.
Dubai is a small world.
But I think you found me.
Yeah.
Okay,
I think what it went, if I go back when I first came back from Australia, like came back to Dubai in 2015, I started practicing. The place that I was practicing was where you used to practice. You just left, I think, 6 months before I joined. And during the first year, Ramadan came over, colleagues were all having, let's have a iftar dinner together. And I was told, like, oh, we've got some ex-colleagues of the clinics joining. And mind you, I was sitting on a table, and to my right side was Dr. Hakim and his wife. And I was told, yeah, he told me you're an orthodontist, came from America, and I was practicing here. And that's what I told you, is like, Dr. Hakim, actually, I want to be an orthodontist. That was my passion as a kid. What advice do you give me as someone who's here? I still remember them. You're like, either go down the academic route, focus on research papers to do with orthodontics to help you with admissions, or go down the clinical route. You're working in an orthodontic practice, so be involved in the cases, look at them, try to be part of the treatments that's being done, and gain those 2, 3, 4 years experience and apply with that. And mind you, 4 years later, submitted an application with ortho supervision background in Dubai, and I got my post in England.
Okay.
That's it.
We
came back, here we are. Of course, while we were overseas, we have these online courses that you're part of with different organizations. So I used to still see you online, different classes that you gave. And then after England, came back to Dubai, I actually had one of these conferences where you were a guest speaker in them. And when I saw it, I remember, oh yeah, I remember this person. He gave me the advice. Why not ask him what job opportunities are there? And here we are now in a podcast.
Fantastic. Yes, excellent. But I think the story is different with you because as we were growing, we needed someone, right? Our team was growing, and we needed someone, and obviously we kind of put the message out there that we're looking. But how did I come across you, Anna, if you want to share?
Actually, it was very interesting because it was also a little bit similar in terms of the conference and everything, but I didn't know you. But I went to this conference wanting to do some network, to meet new people. I had that in my mind, to maybe looking for new opportunities. And actually, it was through jiu-jitsu, which is my side job, that we have a doctor in common, Dr. Karim, and he's still working with you. And he told me there is an orthodontist. He's really good. He's always looking for new people to join, to help. He's very kind. And actually that day, I was already registered for your workshop, like the roundtable hands-on course. So he introduced me to you. I did the course, and again, after that, the rest is history, and
here
we
we
are.
Yeah.
Of course, I was still waiting for the paperwork and everything, so the specialist license was on, and like the same day, I was sending you a message. Hello, I'm here.
Excellent.
Yeah,
so yeah, I think you can see we work together very nicely, very diverse backgrounds, but this is one of the many beauties of Dubai, is it just brings people together. And we hope you enjoyed this. We hope you can join us for the future ones. And always remember, don't just smile, smile healthy.